Over the last century, psychedelics have shifted from being marginalized substances to becoming central topics in mental health research. Today, scientists around the world are asking a crucial question. Can these substances, when used responsibly and within structured clinical settings, help treat depression, anxiety, or trauma? In this video, we will explore 6 foundational scientific studies that investigated this question. We will not rely on opinions or anecdotal reports, only on controlled trials and peer-reviewed research. Throughout this video, psychedelics refers mainly to the classic serotonergic psychedelics, psilocybin, DMT, LSD, and mescaline, as well as MDMA when used in structured therapeutic protocols. These substances act primarily on serotonin receptors, modifying how the brain processes perception, cognition, memory, and emotion. What science aims to understand is whether these temporary changes, combined with psychological support, can produce real and lasting improvements in mental health. This study involved patients with moderate to severe major depressive disorder who were not responding well to standard treatments. Participants received 2 sessions of psilocybin, each supported by preparation sessions and post-experience integration therapy. Assessments were conducted before, during, and several weeks after the session. What did the researchers find? There were significant reductions in depressive symptoms, with large effect sizes. Many participants maintained improvements for weeks or even months after just 1 or 2 carefully supported psychedelic sessions. This study gained global attention because it showed that a structured, relatively short protocol could lead to meaningful clinical changes. This trial focused specifically on treatment-resistant depression, where multiple antidepressants had already failed. In a phase 2, double-blind, randomized controlled trial, participants received a single dose of psilocybin under clinical supervision with therapeutic support. In finding what into dose site? The higher dose produced significant reductions in depressive symptoms 3 weeks after treatment compared to the control doses. This study reinforced the idea that psilocybin-assisted therapy may offer a viable option when conventional treatments are ineffective, provided it is delivered within a rigorous clinical framework. This landmark study examined the antidepressant effects of Ayahuasca, a brew containing DMT and datcarbolines. In a double-blind randomized trial conducted in Brazil, participants with treatment-resistant depression received either Ayahuasca or a placebo, both administered in a hospital environment. The results were striking. Just 24 hours after the session, the Ayahuasca group showed significant reductions in depressive symptoms compared to the placebo group. For some individuals, improvements lasted several days. This was a milestone because it demonstrated, under controlled conditions, that a single Ayahuasca session can produce rapid antidepressant effects when delivered responsibly. Additional open-label studies also examined Ayahuasca's effects on depressive symptoms. In one such study, participants received a single Ayahuasca dose in a clinical setting and were monitored over 2 to 3 weeks. The results show there was a rapid reduction in depressive symptoms within 24 hours, sustained partially over the following weeks. Another study, with a larger sample size, added neuroimaging data showing changes in brain perfusion in areas linked to emotional regulation. Together, these studies strengthen the hypothesis that Ayahuasca may have fast-acting antidepressant properties, especially when combined with psychological support. Although MDMA is not a classic psychedelic, it is often included in the broader category of psychedelic-assisted psychotherapy. In several phase 3 clinical trials, participants with severe post-traumatic stress disorder, PTSD, underwent a structured protocol combining psychotherapy with 3 MDMA-assisted sessions. The results showed that There were major reductions in PTSD symptoms, and a high proportion of participants no longer met diagnostic criteria after treatment. The robustness of these findings prompted serious international discussion regarding the potential approval of MDMA-assisted therapy in clinical practice. Beyond clinical trials, several observational studies examined people who participate regularly in structured ayahuasca content. These studies compared long-term ayahuasca users with matched control groups and found, on average, lower levels of depression and anxiety, a reduced problematic substance use, improved well-being, and higher life satisfaction. These findings do not prove causation. They are correlational, but they suggest that consistent, structured environments may contribute to psychological stability, raising important questions for future research. When we examine these 6 studies together, several consistent themes emerge. 1. Psychedelics are never used in isolation. Every successful protocol involves preparation, clinical supervision, and post-session integration. 2. The most meaningful effects are not only acute. Improvements often last weeks or months, even after 1 or 2 sessions. 3. They do not work for everyone, and they don't so individual variability is high, and psychedelics are contraindicated for certain populations. 4. Risks are real and must not be minimized. Screening, medical oversight, and ethical frameworks are crucial. 5. The experience itself is not the therapy. Lasting benefits emerge from the psychological integration that follows the altered state. Current evidence does not present psychedelics as magical cures, but as potentially powerful tools within structured therapeutic framework. The studies we examine today show that treatment-resistant depression, anxiety, trauma, and deep emotional distress may respond significantly to psychedelic-assisted psychotherapy. The next step for science is to conduct longer, larger, and more comparative studies, exactly the direction we aim to follow in the Global Psychedelic Health Research Project. Subscribe to the channel, share this video, and join us as we explore ethical, evidence-based approaches to psychedelic-assisted mental health care, science, ethics, and mental well-being. We have some important considerations. The psychedelic therapy is not appropriate for everyone. Medical screening, psychological assessment, and professional supervision are essential for safety and efficacy. These substances carry risks when used improperly or without appropriate support. The research we discuss involves controlled clinical settings with trained professionals, vastly different from unguided or recreational use. You can support our work. The future of mental health treatment may be profoundly transformed by psychedelic research, but only if we approach it with scientific rigor, ethical responsibility, and genuine care for those suffering. Join us as we explore the science behind these remarkable compounds. Together, we can separate evidence from hype and advance mental health care for those who need it most. Please contact us to find out how you can help support our research.